Hello, Dr. Vicki Peterson here. I want to talk to you today about, if you're a parent, how would you know to be suspicious of celiac disease or gluten sensitivity in your child? There are many different symptoms associated with this. I just want to go over and highlight some of the most common ones. One is short stature, so if your child is petite in height and it's not expected based on the height of you and the child's other parent. In other words, they don't conform to what you'd expect them to be height-wise. That's something to consider. Enamel defects on the teeth. So if you go to the dentist and they have sort of speckled teeth, unfortunately most dentists don't know that that's one of the causes behind dental enamel defects, but it is. So that's something you would see on your child's teeth, and the dentist would point them out as well. Seizures is a very serious side effect of gluten, potentially, as are headaches, whether they're migraines or regular headaches, either one. Any sort of skin condition, a rash, bumpy skin, dry skin, itchy skin, eczema. So those are other things to look for. Fatigue. Classic digestive symptoms associated with celiac disease are constipation or diarrhea, often more diarrhea. Gassiness, abdominal pain. Being underweight is another classic symptom. Let's see what else I have here on my long list. Autism, ADHD, depression, anxiety, and joint pains. A lot of times they call that growing pains, and sometimes it is, but a lot of times it's not, and it's an indicator of gluten intolerance. Also acid reflux and esophagitis, so that would be something the child would be diagnosed with, and doctors often don't realize that it's due to gluten intolerance. So let me check my list and see if there's anything else I missed. No, that was it. So these are the things to make you alert, and then what do you do once you're alert to it? Of course, you bring your child to their pediatrician and ask for a test to diagnose celiac disease. They should be doing a blood test that would be measuring something called TTG, perhaps something called EMA, which is for endomysial antibodies, and also AGA, which is anti-gliadin antibodies. At least the AGA and the TTG should be done to assess for celiac disease. Now, as far as gluten sensitivity is concerned, we utilize a test by Cyrex Labs. It's very comprehensive. It looks at more than a reaction to having the body react to gliadin, but other segments of the gluten protein as well. So it is comprehensive. We consider it a very good test. As far as researchers are concerned, gluten sensitivity is really very, very new on the horizon, so there's not an accepted test for it yet. New research that just came out does state that if a child, well, anyone, does not have a wheat allergy, which is kind of rare, they do not have celiac disease, yet they improve on a gluten-free diet, that is reason to then give them the diagnosis of gluten sensitivity. So if either your child gets a celiac test and it's negative, or your doctor refuses to test your child because he or she doesn't feel that your child's symptoms warrant it. Unfortunately, that happens a lot. Doctors are not that aware of all the varying symptoms associated with celiac disease. So if that happens, there's nothing wrong with, at that point, putting your child on a 30-day gluten elimination diet and seeing if they improve. And if you notice improvement, then that is considered a positive test based on very new research. So also, there are genetic tests, so you can see if your child carries the genes for celiac disease or carries the genes for gluten sensitivity. Entero Lab is a lab that you can do online and by yourself. It's very easy. It's just a swab inside your child's mouth, so they're not being inflicted with a needle, and you can find out if they carry the genes. So that's a good place to begin as well, to see if they're susceptible. So it's there's a lot of information there. Please let me know if you have any questions. I'm always here to help, and there's nothing like starting early in life and finding out if this is a problem for your child, because then you're setting them up for such a nice, healthy adulthood. All right, I hope that was helpful, and until next time, I wish you very good health.